And here we are on the couch with Ellison from Bowel Cancer New Zealand. Ellison, you've got a very important message you're talking about today.
Yes, I represent a group of patients and families who have been affected by bowel cancer and have learned through their unfortunate experience a lot about it, and that bowel cancer is extremely detectable, treatable and beatable, and we want to get the message out there that caught in its early stages it's 75% curable. So it's most important that people know the symptoms of bowel cancer. It's really important that they are not embarrassed to act on symptoms of bowel cancer, and we say talk to your GP, and if you've got any concerns at all, don't let anybody tell you you're too young to have bowel cancer. Although bowel cancer is mainly, your risk of bowel cancer is much greater once you get to 50. Anecdotal evidence tells us that more and more young people are presenting with bowel cancer.
So signs and symptoms, what are the signs and symptoms?
Signs and symptoms, change of bowel habit seems to be one of the most common ones. Of course, bleeding from the rectum, and so looking at your toilet, in the toilet after you've been, is very important. Abdominal pain is another quite common one. There's also anemia, but that's detected by a doctor, but that's quite a specific sign of bowel cancer.
So really, I mean, once people have recognised that, what happens next? Because that's the thing that people are scared about, isn't it?
Yes, that is. Well, the most important thing is to talk to the GP, first of all, and just do that. What we would like to see is that more people are getting colonoscopy, but that's not really the case, because there is such a waiting list for colonoscopy that I think a lot of people are not dealt with in a timely manner, because there is such a glut of people waiting to have colonoscopy. But you know, clearly, if people were able to access colonoscopy, I think that it's so curable if caught early.
But the whole thing about colonoscopies is that people are often shy away from that because it's potentially embarrassing. But the reality is it's not that bad.
The reality is it's not at all bad. I've had many colonoscopies, and I know lots of people who've had colonoscopy, and they will all say afterwards, "Oh, I was so scared of that," and yet it was nothing, absolutely nothing.
Yeah. No, I would agree. I've had several as well.
Yes.
I chose to have mine without the sedation, because it was a memorable experience to me, and often with the sedation you don't remember afterwards, so I was pleased to be able to have it without sedation, and I've got memories of my own bowel. Not many people can say that.
Yes, exactly. Yeah. One of the things we do say is don't sit on your symptoms.
Yes.
Do something about it, and it's never as bad as you think it's going to be, and once you've talked about it and the stigma is taken away of talking about bowels or bottoms, then it becomes a lot easier.
It's a difficult message to talk about, but you've got a kind of funky way of getting the message out there. I've seen your Facebook page, which has got a lot of activity, which is fantastic, your website, but you're going to show me your bum.
Yes, absolutely. I wear my bum often, and I say, Kim Kardashian, eat your heart out, but everybody can have a bum like this, but this is our message.
So that's a pair of shorts.
This is a pair of bum shorts, and one size fits all. I will show you, and they're great fun, and they have really opened up the field of discussion about bowel cancer. It's our best awareness tool. People like it's a serious subject, but a little bit of lightheartedness certainly helps people to talk about things that they normally wouldn't feel comfortable about.
You've also got some promotion with Cotton Soft.
Cotton Soft are one of our major sponsors, and they have been very proactive and supportive for our charity, and they have recently run a campaign called I Give a Crap campaign, which is encouraging people to support bowel cancer and to screen for bowel cancer with fecal occult blood test if possible. They can order fecal occult blood tests through their GPs, but they can also buy a commercially available fecal occult blood test, fecal occult blood test, through a chemist shop or through our website. And that is the test that is being used in the white matter DHB pilot, which is being so successful. We're just really sorry that it's not, the government hasn't committed to rolling it out nationally, because it is it's an amazing program, and we should have a national bowel screen program in New Zealand. We're years behind our counterparts in the developed world, and New Zealand people are suffering.
thank you very much for your time. Love the message, and the message I think is lock down the toilet.
Thank you.